Hi, I'm Dr. Mukesh Gupta from Lenest, Mumbai, Obstetrician and Gynaecologist. 40 tips to 40 weeks, week 23. Kya lie am? What is the tip for this week? Well, this is an interesting tip for work-life balance. The tip is, it's always a good time to set your priorities right. And what better than pregnancy? During the course of pregnancy, sometimes we feel that whether we can work or not, whether we can continue our profession or not, how much time should we give, will I be able to cope up with the pregnancy and yet not lose out on my opportunities in my career, will I not lose out on my opportunities to go for that dream destination vacation which I always planned and now there is an opportunity to do that. Well, these are the things which will keep on happening during the course. 9 months is a long time, and add to that a few months of the early, motherhood. So if you look at this long period of almost a year, it's a very long time. And sometimes we feel that our life is put on a back burner just because we have chosen to be pregnant. Well, this is the most important aspect which you need to address during the course of pregnancy. Never get so busy in making your living that you forget that you are making a living being inside you. Well, when you are pregnant, this in itself is an amazing opportunity to realize that this is one of the priorities which you wanted to achieve in life. Having a child, being a parent, going through the years of upbringing of a child is something which you were looking forward to and will also help you nourish your life. So if you are thinking that it is coming in the way of your profession and career, it may not be wrong. I am not denying that. But in reality, if you strike it right and set your priorities, it may not be a big deal. So for example, if you're going for working and you're a professional lady, you may chart out your professional plan in such a way that you are not very aggressive on physical activities, but you are still indulging in a lot of mental and networking abilities which are involved with your profession. So nobody has stopped you from communicating from the phone or, doing all those, think tank discussions with the team and all those things. But when it comes to physical labor and activity, you may need to be a little smart in choosing what needs to be done and what needs to be left behind. So you can't have everything every time that you want, but you will definitely have those things which matter the most to you. So if you are able to time yourself, if you're able to plan your profession, it'll be a great deal. So the question is, when should we take our maternity leave? When should we stop going to the office? When should I resume my routine life? These are the million-dollar questions that needs to be understood. Well, the basic rule and dictum is what you have been doing routinely, which doesn't cause any risk of infection, exertion or accident, you may continue to do that as long as it is not affecting your risk of infection, accident and exertion. So if you are working in a safe environment, you may continue to work even towards the last weeks of your pregnancy. It is not really necessary for you to just sit in the house and leave everything. Unless there is a medical reason which your doctor has asked you to take rest for. If there is some kind of complication like maybe placenta previa or preterm labor or multiple gestations or similar such things, or maybe hypertensive disorders of pregnancy, you may need to slow down a little early. You may need to be a little more careful. You may need to avoid exertion in those situations. But in most normal pregnancy, which is the case for almost 3 out of 4 pregnant women, you will not have any major concerns and you will be able to continue your working. So last but not the least, remember that work-life balance is something which you cannot discount, and set your priorities right. It is never a bad time to start to set them right. Thank you.